Hello future doctors, how are you all? Welcome back to MedSteps YouTube channel. So today we are going to discuss about hallmarks of cancer in general pathology and how cancer evades the immune system and what are the most common cancers by gender and age. So we will break it everything. I am going to cover everything. So if you have any doubts, you can ask me in the comment section. Myself, I am Anandjana, final year medical student. So, what is cancer? Cancer is the result of accumulated DNA mutations that affects fundamental process like growth, survival and repair. These mutations cause uncontrolled monoclonal proliferation of cells. Over time, these changes give rise to what we call the hallmark of cancers. So, hallmarks of cancer means cancer is caused by mostly acquired means accumulation of DNA, or you can tell DNA mutations that affects fundamental cellular process like fundamental cellular process means like growth, survival and repair. Okay, so these mutations cause uncontrolled monoclonal proliferations of cells, and this process we call mutations give rise to hallmark of cancer. Okay, so now what is hallmark of cancer? We classify the key features of cancer into 7 major hallmarks. Okay, the 7 major hallmarks, and each one corresponds to a mutation or mechanism that helps tumors grow, survive and spread. In the 7 major hallmarks, first one, growth signal self-sufficiency. Second one, anti-growth signal insensitivity. Third one, evasion of apoptosis. Fourth one, limitless replicative potential. Fifth one, sustained angiogenesis. Sixth one, tissue invasion. Next, metastasis and Warburg effect. Okay, so now we are going to discuss each and every major hallmarks. First hallmark will be growth signal and self sufficiency, or you can tell self sufficiency in growth signals. Here these cancer cells no longer depend on the external growth signals. Okay, so if you are seeing here, you can see here this is the mutations in gene encoding, and we can see here proto-oncogenes and increase growth factors and autocrine loop, example like increasing PDGF in brain tumors. Okay, growth factor receptors like constitutive signaling, example like HER2 and neutral in breast cancer. In signaling molecules, example RAS. In transcription factors, example like MYC, and cell cycle regulators, example cyclins and CDKs. For example, overexpression of this PDGF in brain tumors or HER2 neutral in breast cancer, they may produce their own growth signals like autocrine stimulation. Because of this autocrine stimulation, the tumor will grow by own because of stimulation. Okay, so this is the main concept for self sufficiency in growth signals. Next one, second major hallmark is anti-growth signal insensitivity. So insensitivity to anti-growth signals means its normal cells stop growing when crowded due to contact inhibition. For example, this is mutations in tumor suppressor genes, example RB. We can see in anti-growth signals insensitivity loss of E cadherin function and loss of contact inhibition, example NF2 mutation. In cancer cells, loss E cadherin, a molecule is very responsible for cell adhesion and inhibition. For example, the NF2 gene mutations disrupt this control. Third major hallmark will be evasion of apoptosis. This evasion apoptosis means cancer cells bypass programmed cell death. That means it's mutations in gene that regulates apoptosis, that means programmed cell death. the cell will kill by own or it will stimulate by own. For example, we can see TP53, BCL2 and follicular B cell lymphoma. In key mutations include like TP53 means TP53 means the guardian of the genome, and BCL2 means anti-apoptotic protein in follicular lymphoma. Okay. Next one, fourth major hallmark will be limitless replicative potential. This limitless replicative potential is normal cells age and die due to telomere shortening. So here this is reactivation of telomerase, maintenance of lengthening of telomeres. If you know about gene, we can, in chromosome we can see telomeres. So this limitless replicative potential is happening in chromosomes. Okay, in chromosomes mostly we can see telomeres. That telomere will be get reactivate because of reactivation it will get length, and we can see prevention of chromosome shortening and cell aging. Okay, so this normal cell age and die due to telomere shortening, and cancer cells react to telomerase, preserving telomeres and enabling endless division. Next, fifth one, we can see sustained angiogenesis. Sustained angiogenesis means the tumors need blood vessels for oxygen and nutrients. They release VEGF and other pro-angiogenic factors, and the vessels formed are often leaky and abnormal. In increased pro-angiogenesis factor, example VEGF means vascular endothelial growth factors or decreased inhibitory factors. Factors may be produced by tumor or stromal cells. Vessels can sprout from existing capillaries, or the thing we call neoangiogenesis. That means new capillaries or new vessels are forming, or endothelial cells are recruited from bone marrow like vasculogenesis, and vessels may be leaky or dilated. Next major hallmark will be tissue invasion. Tissue invasion means it's like loss of E-cadherin functions. Okay, so in tissue E-cadherin we can see here, this is cancer cells invade basement membrane and membranes using metalloproteinases. So here you can see loss of E-cadherin function and loosening of intracellular junctions, and metalloproteinases degrade basement membrane in an extracellular membrane. The cells attached to extracellular membrane proteins like example laminin and fibronectin. This is very important proteins, so we have to know these things properly. And the cells migrate through degraded extracellular membrane like locomotion and vascular dissemination. Next we can see that is this E-cadherin will loosened junctions, like cells migrate through extracellular membrane and spread via lymphatics or blood. Okay, so next one, metastasis. Metastasis means because of loosening of junctions, the cells will migrate to extracellular membrane and it will spread via lymphatic and blood. So the tumor cells or emboli will spread and it will cause metastasis. Metastasis means from one place to another place, spreading things we call that is metastasis. This adhesion to endothelium and extravasation and homing, site of metastasis can be predicted by site of primary tumor. With primary tumor we can easily understand how that tumor will spread. Mostly more amount of vasculature and lymphatic drainage. If you are seeing means there only we can get more amount of tumor spreading. Okay, we can easily suspect that thing. As the target organs is often the first encountered capillary bed, like seed and soil therapy. Some cancers show organ tropism. Example like lung cancers commonly metastasize to adrenals. So here cancer spreads to distant organs, often the first capillary bed it meets. Example lung cancer, then after we can see adrenal gland cancer, then after colon cancer, then after liver. So this is the step by step spreading metastasis thing. Okay, If lung cancer is there means 100% the patient will get adrenal gland cancer, and because of that adrenal gland cancer, then after it will lead to colon cancer, then after liver cancer. Okay. Next one, Warburg effect, last major hallmark. This Warburg effect means this tumor cells shift metabolism from oxidative phosphorylation to aerobic glycolysis even when oxygen is present. Okay, it will like shift of glucose metabolism away from the mitochondria oxidative phosphorylation towards glycolysis. Why? This Warburg effect, this helps them survive in hypoxic environments and generate building blocks for new cells. Okay. Next one. Next we are going to discuss about immune evasion in cancer. Why this thing is important? Because it will help to survive. Cancer cells must hide from the immune system. Here's how they do it. First one will be decrease this immune cells can recognize the attack tumor cells. So we can for successful tumorigenesis, tumor cells must evade the immune system. Multiple escape mechanisms exist. So in first will be, we can see how that tumor cells recognize and attack cells means. First, the decreased MHC class 1 expression. Here what will happen, the tumors stop expressing MHC1, so the cytotoxic T cells can't recognize them. Okay. Next one, immunosuppressive factors. This immunosuppressive factors means the tumor cells will secrete this immunosuppressive factors. We can see like tumors secrete TGF, tumor growth factor beta, and attract regulatory T cells to suppress the immune response. Next one, the next thing we can see the tumor cells upregulate immune checkpoint molecules, which inhibits the immune response. That means the tumor cells express PD-L1, which binds PD-1 on T cells and T cell exhaustion. So with this PD-L1, that ligand 1, we can easily find out that is drugs like nivolumab and pembrolizumab block this checkpoint and reactivate T cells. Next one, CTLA pathway, you can see here. This is the CTLA pathway. In the CTLA pathway, it competes with CD28 for B7 and APCs inhibits T cell activation. Ipilimumab is a checkpoint inhibitor that blocks CTLA4. Okay, so here why this thing is important. This immune evasion is what's the main important means. Cancer is very smart. It finds way to trick and hide from the immune system. This process is called immune evasion. Okay, so here we can see here this immune checkpoint interactions. The immune checkpoint interactions means it will help to fight the immune evasion. Modern medicine uses immune checkpoint inhibitors. Okay, these drugs remove the brakes from the immune system and reactivate T cells. First of all, we have to see the interaction between PD-1 and T cells. Okay, this PD-1 or PD-L1 pathway, here what we can see, this PD-1 is found on T cells and PD-L1 is expressed by tumor cells or surrounding immune cells. When PD-L1 binds PD-1, T cells becomes exhausted. Drugs that block this like nivolumab and pembrolizumab. Okay, these are these drugs we called anti-PD-1 drugs. Okay, next one we can see here, that is atezolizumab and durvalumab and evolumab. These are the drugs of anti-PD-L1. These drugs will be anti-PD-L1. L1. Okay, so if you are seeing this pathway, you can see here the CTLA4. The CTLA4 on T cells compares with CD28. Okay, the CTLA4 is compares with CD28 for B7 and APC cells, APCs. The CTLA4 wins, T cell doesn't get activated. Drug that blocks CTLA4 and ipilimumab helps restore the T cells activation. So, in cancer epidemiology, we can see what's common and what's deadly. Okay, so we can easily differentiate these things because this part is very important for your exam point of view. Okay, in skin cancer we can see like basal mostly, then after squamous, then after melanoma. It is the most common cancer that not included below. Okay, that means here most common cancers will be, if you are seeing in men, you can see prostate cancer, lung and colon rectum cancer. In women, breast, lung, colon and rectum cancer. In children, we can see like 0 to 14 years old, like leukemia and CNS tumors and neuroblastoma. Most common cancers, it can cause like death, mortality, it will increase the mortality rates. In men, lung, prostate and colon rectum cancer. In women, lung, breast, colon rectum cancer. In children, leukemia, CNS tumors and neuroblastoma. Okay, so for exams it's very important. The skin cancer we can see like basal, greater than squamous, greater than melanoma is the most common overall, but this is like most common. Okay, the lung cancer will be still, it's like one main killer even though incidence in men is decreasing. So how we can manage this immunotherapy means with immune checkpoint inhibitors. We already discussed here. This drugs, everything will comes in immune checkpoint inhibitors. This we can now treat cancers that were previously hard to manage. These drugs are now used in for cancer and these things. Okay, so the checkpoint inhibitors indications will be melanoma patients, non-small cell lung cancer and renal cell carcinoma, Hodgkin lymphoma and head and neck cancers. We can use this type of immune checkpoint inhibitors. The checkpoint inhibitor side, we have some side effects, that is it's like reactivation of immune system can lead to immune related adverse events like colitis, hepatitis, pneumonitis, endocrinopathies like example thyroiditis and hypophysitis. These are the side effects. So after causing this type of side effects, then we can use for management, we can start corticosteroids and temporary discontinuation. Okay, I hope this video is very helpful to you. If you have any doubts, you can ask me, you can drop one message in comment section. Till now you didn't subscribe my channel, like, share and subscribe. We will meet in our next video. Take care, bye bye.